how can people start to take action, or what are some of the things that they can do to mitigate inflammation from happening? Like, avoid sugar. Like, if there was only one thing you could do, avoid sugar. What's your recommended starting point as like a doctor?
I think that probably fasting would be the first thing I would do. Giving your body time and rest where it's not metabolizing is a great way to get back to a normal state. We've been constantly feeding ourselves for so long, and this is so different from the way that our physiology developed, that I think the best thing to do to start with is to just have a regular amount of fasting that you do. And 12 hours seems to be the minimum that is helpful physiologically. And most of that time can be sleeping. If you can't do anything else, stop eating at 8 p.m., right? Make sure you had your last bite at 8 p.m., go to bed at 9, have breakfast at 8 a.m., right? Most people can do that, right? If you do that on a somewhat regular basis, you're going to start to bring the inflammation down. You're going to start to let your body metabolically start to regulate itself more. Sleep 8 hours a night if you can, and then exercise 15 minutes of high intensity exercise a day if you can do it. Those would be the top three, right? If you can do even any one of those three, that's a great starting point. Inflammation, it has flame in the word. I think people think of sort of hot, and if when you sprain your ankle, your ankle gets warm, right? You've got increased blood flow to the area. It's your body reacting to something that either happened internally or externally, and usually it's basically this set of responses that's designed to keep any kind of foreign invaders out. So any kind of bacteria or parasite or things like that, which in former times was a big deal, right? We were living out in the woods. We were exposed to things all the time, and having a robust immune system that could generate this response or inflammation was really helpful to our survival for such a long time. And that's really where it came from. Now, the type of inflammation that you get when you sprain your ankle is acute inflammation. That usually it comes quickly, and then it resolves pretty quickly as well. There's another type of inflammation which is more consistent with what you see in what we call the chronic diseases, everything related to metabolic health, arthritis, things like that. And that's chronic inflammation. Essentially, it involves changing your immune response over time and putting it into sort of a heightened alert state. And it's that heightened alert state that creates all the problems going forward. Inflammation is, if I don't know if you've ever looked at your blood up close, and you'll see that the red cells have these cool biconcave, they're these smooth walls that they have, and then every so often you see a white blood cell in there. The white blood cells are the ones that are really responsible for all of inflammation and all of the inflammation that occurs in your body. They go through all different tissues and they generate that inflammation.
So with the idea of chronic inflammation, what do you think it is, like, with acute versus chronic, when people think about treating or mitigating it? Is it that acute is so easy for people to see and feel that they're like, I have to do something about this, whereas chronic, you don't necessarily know, you can't see it, especially if it's inside your body. And so it's really easy to use something like hyperbolic discounting, where in the near term, you're going to keep doing these things that are leading to downstream implications for something like chronic inflammation, because it doesn't happen in one day. It's not immediate, it's over time. But chronic, from the sounds of it, is way worse. Like, acute is sort of happens, it goes away, provided it heals. It goes away and it's like not there anymore. So it's out of sight, out of mind. Like, you almost forget that, oh yeah, I sprained my ankle, or oh yeah, I cut my finger and it healed. Like, you forget those things. But chronic, by the time you realize that there's something wrong, it's like it's been going wrong for so long that it's not just
Yeah.
one day. So what is it
Well, I
that,
think
like, what is it? Like, what is it that makes people go down these paths? Is it the idea of not knowing? Is it hyperbolic discounting where there's a bit of a psychological game with it? Like what sort of, from your experience, how can people mitigate things like chronic inflammation way before it starts?
Well, I think the biggest thing is having some way to sense it, right? We talk a lot about interoception, right, in our behavior change blogs and things like that. This idea of sensing what's going on in your body. Acute inflammation, you can almost always sense. Maybe you got an allergic reaction to something. You definitely know that that's there. You have hives, all these things happen. You can sense that there's a change. Whereas chronic inflammation, you don't generally sense at all. You don't feel it. And it's just this thing that kind of builds up and is happening over time. And I think that's why that one, it's so difficult for people to get a hold of and to deal with. It's because they don't see it, and even if they did, honestly, they wouldn't know how to fix it. You can put some ice on a sprained ankle. You can take some Benadryl or go see a doctor for your allergies. It's really hard to say, "Hey, I've got chronic inflammation. What, I'll just do this thing." And I think that's the origin of why people kind of get into it, and measuring that chronic inflammation may be one of the first ways that we help people really deal with it.
When you're looking for certain markers though, like are there things that can lead someone to identify, hey, this might be an outcome? There's certain biomarkers like uric acid. Is that one
Sure.
where, is it like what is it? There's uric acid, there's glucose. Like what if you're looking at the top markers that might indicate, hey, there's more to the picture here. There's something you should think about long term. What are some of those markers that give people insight to dig deeper into what might be a case of chronic inflammation?
Yeah, I mean, most of them aren't checked by your doctor regularly, right? Um, so, I think CRP is the only one that kind of, shows up on panels regularly. And that's a pretty good indicator that you have some kind of acute inflammation going on. That tends to go up with viral and bacterial infections, and it can be up for a variety of other reasons as well.
And
Um,
CRP is
C-reactive protein. Maybe to jump up a level, there are kind of two major types of inflammation. There's what's called cell-mediated inflammation, um, and then there's humoral inflammation. And so it's Th1, and it's a certain type of white blood cell that tends to mediate how your body handles inflammation. Inflammation is actually this big cascade of things that happens simultaneously, and it's coordinated by your white blood cells mostly. And the white blood cells produce some of the components related to inflammation, and actually other cells in your body produce other components related to it. So for example, there are these cells called macrophages that will show up in a bunch of tissues, and those are related to both acute and chronic inflammation, and both the cell mediated and non-cell mediated inflammation. And those ones go around gobbling things up. They'll gobble up, pieces of cells that have drifted away, or, they're involved in helping to reduce, or expand the plaques that form in your arteries for cardiovascular disease, because those fat and cholesterol plaques can generate an immune response as well. And then so that you have this group of cells called macrophages that have this variety of roles in cleaning stuff up. And then you have a number of other cells like the mucosal cells that line your lungs or line your intestine. Those produce a bunch of components that can actually fight or kill bacteria directly. And the immune system tells those cells when to increase or decrease the amounts of those components as well. And generally, what we look for if we're trying to determine whether you have chronic inflammation and how serious it is we're looking for the components that are produced by the master regulator cells, these T helper cells that are pushing the immune response in one direction or another. So in addition to CRP, there are things like TNF alpha, there are interleukins 3 and 6, and 1 beta. There are a number of other molecules that are produced by these cells that essentially coordinate the whole system and tell the body to rev up its fight. against potential invaders. And by keeping the body on high alert over a long period of time, that that actually mediates other big changes in the body. So, as an example, when you we talk a lot about insulin resistance and the development of insulin resistance. Well, it turns out that one of the core things related to insulin resistance may be, and we've learned a lot of this from mouse studies, it may be that as you have a high fat diet, that some of the fats that you eat, particularly the long chain saturated fats like palmic acid, palmitate or palmic acid, um, can actually directly rev up your immune system. That causes macrophages to move into your adipose tissue. The high fat content is taken up by the adipose tissue, so it's growing very quickly. The macrophages move in there, and then they start secreting things that cause the fat tissue to become resistant to insulin. And fat tissue is one of the core tissues that regulates glucose and fat concentrations in your bloodstream over time. So what we're seeing, so to sort of jump back up a level, is that a lot of these changes that we know are correlated with disease, like insulin resistance or plaques forming in cardiovascular disease, are related to inflammation. They're mediated through this chronic inflammation. And it's these white blood cells that are getting signals in different ways that are pushing the tissues to act differently. And that's what causes your increased risk of disease. Does that make
And
sense?
that's why so many biomarkers are needed as far as looking at things holistically.
Yeah,
Because if you're just looking at like glucose in isolation or insulin in isolation, like great markers, but there could be other markers that are way out that you can. Casey often will say you can drink a bottle of canola oil and you can have a very flat glucose response, but that doesn't mean that you're metabolically healthy. And it's true, right? Like you start to look at, because you do that and you do that over time, like that would be an absurd thing to do as a side note, but that would lead to other types of downstream inflammation. Um, it's interesting
definitely.
though, because inflammation, I think maybe this is just a heuristic and incorrect one, but when thinking about inflammation, you often think about tissue, like the sprained ankle is tissue related, the cut finger is tissue related, but it sounds like inflammation inside the body isn't necessarily tissue related. Like when you start talking about plaque buildup in arteries, so like what is it, atherosclerosis, like
Exactly.
that's inflammation, but it's not necessarily like tissue. It sounds like inflammation has um, all of these other, I guess, downstream implications, or these like byproducts of what it is. It's this word inflammation is used just as a bucket almost to throw everything in that goes, this is what happens when you don't treat your body well, when you don't exercise, when you don't eat well, when you don't. It's not just, hey, your tissue isn't. Your tissue is a little bit warm and inflamed. It's a little bit warm and swollen. Like it's not that. It sounds like it's so much wider than that.
Oh, yeah. I mean, inflammation is sort of connected to all the other physiological processes in the body and happens in every tissue in the body, from the brain. And there's inflammation associated with Alzheimer's disease and all kinds of dementia, to the liver, to the skin, to pretty much every organ in your body responds to inflammation. And I think the way I think about it is, we have, on the one hand, you have different organs, right, or different tissue types, and on the other hand, you have these different processes. And a lot of the processes work throughout the body. So nerves are a good example of this. They're a tissue type, but they innervate all through the body. And there are nerve endings that are involved in the direct propagation of information. There are some that are involved in pain mediation. There are some that are involved in your fight or flight response, right? That's the sympathetic versus the parasympathetic. They can drive your digestion. In fact, there's a connection between nerves and inflammation as well, where we find that this, when people are under chronic stress, when they sort of chronically perceive that there's a threat, that drives the immune response in one direction versus another. And as I was talking about before, that tends to drive to production of more of these macrophages that produce more of the tissue damage in the blood vessels and cause insulin resistance and things like this. So there are these processes, I think, that are independent of tissue types that kind of occur throughout the body. And inflammation is definitely one of those. I think one of the overarching mechanisms that we're starting to see is that chronic stress tends to push the immune system in one direction versus another. There are a subset of white blood cells that specifically go through all of your tissues and monitor for any abnormal cells. Each cell actually has this little receptor on it that it presents parts of its inside to all the time. So there are always parts of the inside of the cell that are being presented on this receptor outside the cell. And that is the body's internal way of doing quality control on all of the cells. There are white blood cells that go and circulate around the body and check these receptors to see if those compounds that the cell is producing are normal or abnormal. And um, that's that arm of the immune system is responsible for helping to detect and remove cancers. And what we've found is that when you're under chronic stress, you are shifting the immune system away from that branch that does the internal monitoring. And so you have fewer white blood cells that are going around doing that monitoring, and you have a higher risk of getting a cancer that can then grow out of control. There's another set of um, another way that inflammation plays a core role in cancer. It's really interesting. Cancer cells will start to produce these compounds that redirect that arm of the immune system away from them. And it's a way that they stay cloaked as the cancer grows and grows to a larger uh, to larger size. What we found is that there are a class of molecules that we can use to combat those signals that the cancer cells send out. And by getting rid of those signals, the immune system can naturally get rid of those cancers. And that's been a really dramatic finding that's changed cancer therapy considerably. We have now new cancer drugs that can cure 20 to 25% of melanomas, for instance, which were previously completely incurable. And so you have these amazing results where people can have a particular cancer, and by getting a therapy that removes those cloaking signals, the immune system's able to completely wipe that out. And so that's a case where this inflammation is really critical to making sure that we get rid of cancer appropriately in the body. Um, in terms of rheumatoid arthritis, yeah. So chronic inflammation, and I would say all kinds of arthritis, both rheumatoid and osteoarthritis. Rheumatoid is activated by that uh, second arm of the immune system that maybe we won't get into here because it's a little more complicated. But um, both osteoarthritis and rheumatoid arthritis are essentially mediated by the inflammatory system. So those you and they're actually, I think Levels did uh, it did a blog post about the correlation between glucose, um, osteoarthritis, and there's little mention of inflammation in there. And basically, I think the those what we're finding is, rheumatoid arthritis we already knew um, was essentially a product of abnormal inflammation, and we've developed all these inflammatory mediators to help treat it. I think in the same way that we are, changing these signals to help improve cardiovascular disease, diabetes via, insulin resistance, by reducing the amount of chronic stress, um, increasing the amount of exercise, giving the body periods of fasting where it can kind of get back to normal, you can change those inflammatory signals and impact the way that rheumatoid arthritis, for instance, is functioning. Now, the jury's out on exactly what kind of behavior change would be required to regress once you have rheumatoid arthritis, but you may be able to help yourself from getting it. in the beginning. And then osteoarthritis, similarly, I think what we're finding is that same set of things: chronic stress, high-fat diet, high-carbohydrate diet, insulin resistance, all lead to these inflammatory signals being constantly on, and then that inflammation develops in the tissues and in the joints directly. So you get these groups of white blood cells that actually go into that tissue, and you can lose cartilage. You can have what they call osteophyte formations, these small formations of bone that occur, and that is related to inflammation. Asthma and COPD. There's, yeah, as you mentioned, inflammation from irritants can lead to these lung problems. Smoking is kind of the classic one, and there's a couple of different mechanisms by which inflammation, that chronic inflammation, leads to disease there. There are a couple of other factors for lung disease as well. And in terms of Alzheimer's disease, what we're finding, interestingly, is that there are certain signals that we can turn on in the brain that can actually reduce chronic inflammation or induce an immune response to start cleaning up earlier stage plaques. These plaques that form in the brain form because the body's not taking out the trash anymore. They form because we have those that pro-inflammatory environment, and we're not cleaning up these protein tangles that form in there. So the by they're essentially, by doing these same things that we've talked about, by changing the inflammatory environment, the signals that are being produced by those the T cells and the cells that orchestrate the whole thing, we may be able to change um, uh, the link to Alzheimer's disease. Interestingly, there's a new therapy that's coming out. This is for early stage disease, but what we found is actually making the brain fire at a certain frequency by inducing light that pulses at a certain frequency, or sound that operates at a certain frequency. We can stimulate the brain, uh, the neurons, to fire at a particular frequency, and that actually brings in a new inflammatory response, a new white blood cell response that cleans up those plaques, and that directly reduces disease. So there are a bunch of links here to many different diseases throughout the body. And as we mentioned before, inflammation is one of these processes that is linked to just about every organ, every tissue, and it's because defending the body from foreign invaders and cleaning things up, actually, is such a core part of our maintenance, and of who we are.